It started with something almost everyone ignores, a simple cough. Nothing dramatic, no pain, no reason to worry. At first it felt like allergies, maybe a lingering cold. Days passed, then weeks. The cough didn't go away. It changed. Deeper, more persistent, harder to ignore. Still, it didn't feel serious enough to act on. But just a few days later, everything changed. The diagnosis came back. Stage 3 lung cancer. This is not rare. It happens more often than people realize. Because the early warning signs of lung cancer don't feel like warning signs, they feel small, unrelated, easy to dismiss. Here's the reality. Lung cancer is one of the leading causes of cancer-related deaths. But when it's caught early, outcomes improve significantly. The problem? Most people wait. They ignore the signals until those signals become impossible to ignore. So let's talk about those signals. Not the obvious ones, but the subtle symptoms that often get brushed aside. The ones that could make all the difference. 1. A cough that doesn't go away. Everyone gets coughs, from colds, weather changes, allergies. But this is different. This is a cough that lasts longer than 2 to 3 weeks, doesn't improve with usual remedies, feels deeper, harsher, slowly gets worse instead of better. It lingers long after everything else has gone, and that's where people make the mistake. They wait. They assume it will pass. Sometimes it doesn't. Brute 2. A voice that doesn't sound like yours. It might start subtly. Your voice sounds a little rough, a bit strained. Maybe you think, I talk too much. Must be a cold. But weeks go by, and your voice still isn't right. Here's why that matters. The lungs sit close to nerves that control your voice. When something presses on those nerves, your voice changes, not temporarily, but persistently. 3. Getting breathless. Doing simple things, not after intense exercise, not after running, but during normal everyday life. Walking upstairs that never used to bother you. Doing basic chores, even talking for too long. You pause, just to catch your breath. At first, it's easy to explain away. I'm just getting older. I'm out of shape. But when breathing changes without a clear reason, that's something your body wants you to notice. 4. Chest pain that feels off. Not the sudden, crushing pain people associate with heart problems. This is different. A dull ache, or a sharp pain in one spot. It gets worse when you take a deep breath, cough, laugh. It may spread to your shoulders or your back, and because it doesn't feel dramatic, people ignore it. They assume it's a pulled muscle. Sometimes it isn't. 5. Weight loss. You didn't try for. At first it might even seem like a good thing, a few pounds gone and without effort. But then it continues and you realize nothing changed. Same eating habits, same activity level, yet the weight keeps dropping. Unintentional weight loss is one of the body's clearest warning signals. It means something deeper is happening. Dermbar. 6. Coughing up blood, even a little. This is one symptom that should never be ignored, even a small streak, even once. It can appear as bright red, pink-tinged mucus, rust-colored phlegm. No matter how minor it seems, it needs immediate attention. 7. Getting sick over and over again. This is the most overlooked sign. It doesn't feel serious at all. You think, I just keep catching infections. Another case of bronchitis. But then it happens again and again, often in the same area of the lungs. What's actually happening? Something may be blocking part of the airway. Mucus builds up, bacteria grow, infection returns, antibiotics help temporarily. But the root problem remains. Putting it all together. Here's what makes this difficult. Any one of these symptoms can be caused by something harmless. That's why they're ignored. But when symptoms last longer than expected, keep coming back, or slowly get worse. That's when they need attention. What matters most? This isn't about fear, it's about awareness. Because catching something early can completely change the outcome. Waiting often makes things harder. Your body speaks in signals, sometimes loud, sometimes very quiet. The key is knowing when to listen. If something feels off, if a symptom lingers, if your body isn't behaving the way it used to, don't brush it aside. Check it, because when it comes to your health, acting early isn't overreacting. It's protecting your future.